Well, our mission at Johnson Memorial Health has always been to provide quality healthcare services to our community. Every decision we made is how does this impact patients? How can we better their experience? So we really have three core values: accountability, compassion, and teamwork. And we try to combine those on a daily basis to have the best outcomes for our patients. One of the reasons why I love being in this position as a healthcare provider is I really think, how can I better meet the healthcare needs of this community every day? What services are we not providing that we can get better at?
A lot of the people that work here have trained at all these other places, including Indianapolis. They choose to live and work here for a reason, and that's the feel of this place.
So at Johnson Memorial Health, we pride ourselves on the quality care that we give. We know we can't do everything here, but we want you to start your care here. And if there's a service that you need, if we don't provide that care here, we'll get you to the best partner that we have to provide the best care that you can receive. We talk about the patient first. What we talk about is everything that you do, every thought that you have, every patient interaction should be about ensuring that that patient has the utmost, greatest experience that they can at all touch points throughout our organization.
Our community is pretty much everything for us, and we try to support them as much as they've supported us, which is a lot. When a patient comes to Johnson Memorial, they can expect to be treated like a family member and not a number. Our size is small, but the treatment is top-notch.
There's a lot of hospitals, there's a lot of jobs out there for people. So when you buy into a small community hospital, what you're saying is yeah, I'm buying into this community, and oftentimes you'll find that the people that look for the small town jobs are wanting to give back to their community. And I think we see that with a lot of our staff.
So with our support of the Franklin schools, not only do I feel we've helped to raise the level of healthcare that students receive, but also it's taken some financial burden away from the schools.
The nurses have been great. They're the first line defense working with kids and teachers every day, and also to help just put that face on the Franklin schools and Johnson Memorial Hospital. I meet with Dr. Dunkel every month to talk about how we can make our organizations better. We meet with the mayor, the president of the college, Dr. Dunkel, myself. And it's not about one organization, it's about all of our organizations helping Franklin, and the community then benefits from all the different opportunities that come both from the school system and the organization.
It means a lot to have the healthcare profession at your disposal. Really enjoy the relationship that we have with JMH and Dr. Dunkel. We get together quite often and talk about city issues and hospital issues and school issues and just what we can do to work together and make our community a place to live, work, and play for a lifetime.
With the closeness of Johnson Memorial to the town of Whiteland, it's got a totally different feel than the other competing hospitals. It is a community hospital, so when you go in, it's not the business and making money and seeing as many doctors. They really care about the community because it is community-based, and I think that's a wonderful asset for the town of Whiteland.
I drove an ambulance when I was 17 years old. Spent many years at Johnson Memorial. And in the last few years, we've really seen a huge transformation in not only the outside appearance of the hospital, but also the inside and the inner workings of the hospital. The quality of care has gone up. The quality of relationship has gone up. The quality of atmosphere down there, just that in and of itself has gone up. And you can see that in the employees and you hear that from the patients.
There's just a sense of pride that comes from taking care of a community. I've been a student, I've been a resident at larger places. It just does not feel the same as it does here. I think one of the things that COVID has taught us is that you have to be prepared, that you can't just sit back. You have to anticipate the needs of the community. I think that has changed the way we think. Not that we've ever been status quo, but we have to be more proactive. We have to be more innovative, whether it's technology like telehealth, whether it's trying to find a better coordinated transportation service for our patients to get here. We can't sit still. We have to always look to improve.